Here's our top tips for managing stenosis. Hi, I'm Shelley from Miami Physio, and I'm going to explain lumbar spinal stenosis and give you some management tips. What is lumbar spinal stenosis? So lumbar spinal stenosis is the narrowing of the central spinal canal. So in your spine, there's a bony central canal where your spinal cord sits. Now, as you get older, you get a bit of degeneration in your spine. So this can be facet joint degeneration, so wear and tear, can be disc degeneration, calcification of the spinal ligaments, and formation of the spurs. So lots of different contributing factors that ultimately can cause a narrowing of the spinal canal. So the natural curve of the spine, the shape of the vertebrae in the different sections, and the increased thickness of the spinal cord at different levels means that naturally, when you're standing upright and your low back is relatively extended, there's less natural space available in the lumbar spinal canal. Now, normally this is fine and your cord is perfectly happy. But if you have some narrowing, some stenosis, then being in this position can cause pressure on your spinal cord. So keep watching to learn the symptoms that are associated with lumbar spinal stenosis. It's important to note that you can have narrowing of the central canal show up on a scan but have no symptoms. So the term spinal stenosis refers to the painful symptoms that are associated with the narrowing, not the narrowing itself. The symptoms that patients often report are a combination of low back pain, leg pain, either one leg or both, numbness, tingling, and weakness. Now, the main difference in lumbar stenosis symptoms and other causes of low back pain is that the symptoms are worse when the person is upright and especially walking. So symptoms get worse with walking and are relieved by bending forward or sitting down. Now, walking upstairs or uphill can actually be less painful, as generally you lean forward when you're walking upstairs or up hills. Does this sound like you or somebody you know? Keep watching to learn some tips to manage painful spinal stenosis. As I've hinted at, flexion or bending positions of the spine make more space in the central canal, and therefore they relieve the pressure on the spine. So these positions can be used to help manage this painful condition. So try these things to help manage your pain. Firstly, lean forward on a trolley if you're at the shops. Lean on a walking stick or one of those hiking sticks if you're walking. And when you're walking, take breaks to ease your symptoms, lean forward with your hands on your knees or take a seat. Now, if you're in bed, try sleeping on your side with your knees bent up. So if you get relief with these tips, it's really important to come and have a thorough physio assessment. We can determine whether you require further investigations as part of your management and whether conservative physiotherapy treatment will help you. So from a physio treatment viewpoint, we can work on your posture, your core strength, your spinal movement patterns, and teach you exercises to maximize your function and minimize your symptoms. So if this is something that you would like us to assess, give us a call or click on our link.